We're about to start the first of several panels this afternoon. I hope you find this interesting and timely. The topic, and unless there are deniers in the audience, I think you'll find it interesting and uncontroversial. The topic is climate change and its effect on human health, particularly as it intersects immune function. And we're very lucky to have as our moderator today Brady Dennis of the Washington Post, whom many of you have read, writes on environmental issues for the paper. So thank you so much for joining us today. Brady will introduce the speakers one by one.
How's everybody doing today? Is this on? Okay, great. All right. So thanks for coming. It's an interesting topic, one that's certainly, I think, timely with the tens of thousands of people that showed up downtown this weekend. Certainly a topic that a lot of people care about. So let's jump right in. I'll introduce everyone one by one here, and maybe you could tell us a little bit about your own research. Dr. Doug Norris, he's a professor of molecular microbiology and immunology. You're a vector biologist whose research is focused on malaria in Southern Africa and Asia, diseases such as Lyme disease, other tick-borne bacteria in the United States, and other diseases. I'll let you jump in there.
Thank you. Thank you for the introduction, and thank you for the invitation. Most people just know me as the bug guy. So that's really what a vector biologist does. And I study both mosquitoes and ticks, really at that transmission interface. So over time, we've studied everything from Lyme disease to a lot of malaria work, Zika, dengue, pretty much anything that's transmitted by a mosquito or tick we've taken a look at over time. But again, really looking at that interface, so about 18 years at Hopkins and about 30 years of experience overall, really straddling that field and laboratory interface. So we spend a lot of time out actually where disease occurs and bring those bugs back in to try to figure out why they transmit disease, who they transmit it to, and why the interventions don't work.
Thanks. This is Dr. Murray Ramanathan, and he is a clinician scientist who studies the role of environmental pollutants in propagating chronic sinusitis and allergic rhinitis. Am I saying that right?
Yep,
okay.
Correct. So if he's the bug guy, I'm the snot guy. So I'm an endoscopic sinus and skull-based surgeon. Half my time is really spent taking care of patients with chronic sinusitis, medically managing them and operating on the really, really bad ones. And the rest of my time is spent in the lab understanding how we get chronic sinusitis, specifically the role of the environment, how environmental pollutants and particulate matter can cause inflammation in the nose, specifically in polluted areas, and how people with pre-existing chronic sinusitis can worsen with environmental pollutants as well. So,
thanks. This is Dr. John Aucott. He has more than 15 years of research experience on the crippling effects of Lyme disease, published widely on that, and I'll let you take it from there.
So I happened to be at the right place at the right time when the Lyme epidemic came down into Maryland as a function of both environmental and climate change issues, and we study the interface of disease with the immune system. So you heard about the two-edged sword of the immune system. We look at how it's dysfunctional in Lyme disease. On one edge, the immune system can't control the infection, and so without antibiotic treatment, it's a chronic infection. And on the other end, we think it's also involved in disease manifestations from autoimmunity because the pathogen that causes Lyme disease actually doesn't have any toxins or ability to harm the host, so the damage must be coming from the immune system. So we study that in specific high-risk groups, including sex-based differences in who's susceptible and other high-risk groups for chronic illness with Lyme disease.
Great, thanks. And finally, Dr. Marcia Wills-Karp. She is the professor and chair of the Department of Environmental Health Sciences at Johns Hopkins Bloomberg School of Health. And her research focuses primarily on defining the environmental and genetic determinants of allergic airway diseases such as asthma.
Pleasure to be here today, and first thing I'd like to say is climate change is real. Okay. Hope we agree on that. So I have several hats, and one is directing a Department of Environmental Health and Engineering. And in the department, we're studying the impact of your environment, whether it be the natural environment, the social environment, all aspects of the environment on your health. And in that, we study the effects of water, air, and food on your health. As we know, climate change can impact each of those critical determinants of survival and human life. So we are engaged in many studies trying to understand how climate change is impacting those very essential ingredients to life. In my own personal work, I studied how the environment impacts asthma as an immune disease. And as Steve said earlier, I introduced you to T cells. Some of our early work showed that T cells were involved in asthma, a particular type of T cell. We also know that air pollution and other things involved in climate change can make asthma worse. To give you one example, asthma is generally thought to be driven by allergens. And in Australia in 2016, there was a thunder asthma that occurred. Massive thunderstorms due to buildup of heat caused a huge release of pollen and allergens, and 10,000 people went to the emergency room that night. 9 people died. Okay. This was just from a thunder event. So that's just one example of how climate change and other changes in the environment can impact your health. So I'll stop there.
I'd like to come back really soon and look at some case studies like that from each of your own work about how we see climate effects impacting public health. But first, let's just zoom way out. And I went back and I looked at a study, a federal government study that came out last year that the Washington Post described this way. More deaths from extreme heat, longer allergy seasons, increasingly polluted water and air, diseases transmitted by mosquitoes spreading farther and faster. These are among the health risks that could be exacerbated by global warming in the coming decades. And the White House at the time called it one of the gravest threats to the country. And I wonder, using your own work, if you agree, is that alarmist? Are you seeing, in what ways, might you be seeing that already? Whoever wants to take it.
Okay. I think that statement is correct. And one of the ways that climate change can impact asthma, and this may be somewhat true also for sinusitis, is the increase in pollen levels. As the CO2 rises and heat, there are shifts in the pollen season, and the plants are known to even make more pollen. So there's a bigger exposure to the pollens and things that are exacerbating asthma. That's one trigger of asthma. Another trigger is particulate matter, ozone, air pollution. So with heat, ozone is generated to a higher degree, and there's evidence that ozone exposure in asthmatic individuals can make them have asthma attacks and can worsen disease. The last is mold, and I'll probably leave that to Ram to talk to you about, because it's probably relevant as well to sinusitis. But another type of allergen that asthmatics are allergic to is mold. And with the heavy rainfall and changes in rainfall patterns around the world, there's increased mold exposure.
I completely agree. Certainly with changes in environment, we always see patients suffer more. And it's not so much that you have more people that have these problems, the people that have them, the current medications aren't working. Specifically for the allergies, you have people that are blocked in every possible way, yet they're still really symptomatic because the pollen levels are an all-time high. So you also find that with higher ozone levels, higher particulate levels, you definitely see an impact on the patients, and they come running into clinic and call because nothing they're using is working. So I completely agree with that statement. I mean, it's real.
terms of tick-borne diseases, it's pretty clear that warmer climates help the reservoir. Remember, Lyme disease is a disease of mice primarily, and so the reservoir for the bacteria are mice, and as the warmer weather has allowed mice to move into areas where they weren't able to proliferate before. This is a big problem in especially Canada, where there didn't used to be Lyme disease. Now with increased temperatures, there's spread. We've exported Lyme disease to Canada.
This is certainly the case not only for ticks as well as mosquitoes. As the climate warms, it expands the potential range for a lot of these mosquitoes, not only to far reaches like across the borders into Canada, but also up to higher altitudes. So things like malaria are transmitted now at higher altitudes than they used to be. Longer sort of growing seasons for mosquitoes mean that there's more time available for transmission, and warmer temperatures also decrease the incubation time for a lot of these pathogens that exist in these systems. So where it may have taken maybe 2 or 3 weeks for a mosquito to become infectious after biting somebody that carried a pathogen like Zika, these transmission times can get reduced to 2 weeks or 10 days, which makes the whole cycle sort of circulate faster and propagate at a much faster rate.
Let's talk about a few of those. Dr. Akat, you mentioned the spread of Lyme disease. According to the CDC, Lyme disease incidence has doubled since the early 1990s. The biggest increases are seen in places like Maine and Vermont. You mentioned Canada. Tell us a little bit about the disease itself, how it gets transmitted, and then when it comes to the spread in recent years, what do scientists think is behind that? How do you see a climate fingerprint on that in any way?
So Lyme disease is a tick-borne disease, so it relies on the ticks to transmit it. You can't get it from handling mice. It has to be transmitted from a tick bite. And the ticks are relentlessly spreading. When I first started doing this work, it was really localized along the eastern seaboard and the coastal regions. Now it's spreading westward as well as north and south. There didn't used to be Lyme disease below the into Virginia, but now it's spread down south into Virginia. So all these factors have come together to increase the spread. And there's also another focus in the upper Midwest, starting in Minnesota and then on the west coast of the United States. So it's estimated now there's about 300,000 new cases of Lyme disease a year. So it's really become, it's the most common vector-borne disease in North America right now.
And do you expect that it would keep?
There's been no slowdown in the spread. So every year, if you look at the curve, it just keeps going up and up.
Yeah.
And so, it's a very seasonal disease. Acute Lyme disease is seasonal. So it's starting right now. So the next 3 months will be acute Lyme disease season. And it's not unusual in our research studies. We might get 3 or 4 new patients enrolled in our study in a given day in June. That's how common it is, just from one site in Baltimore. So it's a very common illness.
Got it. Dr. Norris, let's talk about Zika,
Okay.
which probably everyone here is familiar with, and a lot of us studied and covered it over the past year or so. Describe whatever role you may see climate in playing in the way that Zika really spread rapidly through much of South America, northward and into the parts of the U.S. and Central America. Was that possible before? I mean, certainly diseases have yellow fever and dengue and chikungunya have spread wildly, but what role might a changing climate play in an outbreak spread like that?
Sure. So let me just, the caveat being I'll talk mostly about the transmission part of this. The pathology part of it we still don't understand very well, but certainly the transmission part is relatively simple. It requires infected people, the right kind of mosquitoes, and people that aren't infected. And so where we have seen transmission in the US, which is just a very false foci in Florida and one small focus in Brownsville, Texas. So what makes these sites sort of different, and can they expand very far, and does global warming play a role in that? And so these places are sort of pre-adapted. We have mosquito populations that are the correct kind of mosquitoes to transmit the virus. They're warm, so these mosquitoes have a very long transmission season possible to them. In fact, Florida, it's year-round, so they really never go away. So global warming could make those transmission seasons possible at much higher latitudes. So coming up the East Coast, where these proper mosquitoes occur, really along the eastern seaboard. So even here in Washington, D.C., I live in Baltimore, so in Baltimore as well, our primary summer biting mosquitoes are actually the right kind of mosquito, but it requires a lot of input of infected people as well. So global warming expands the season, could make it all happen faster, as I described before, and certainly increases the potential for transmission, but it really takes sort of a magical mix of all the right things to happen at the right time. But as we've seen in Brazil and in other places like Miami, that can really happen.
Well, and Zika was essentially not on anyone's radar. I mean, it had been studied a little bit decades ago, but does this also play into the fact that there can be a wider range of diseases we may not have seen, and maybe diseases we haven't seen in the past?
Sure. I started at Johns Hopkins in 1999, which for some of you that may remember, that was also the year that West Nile was introduced into North America. A few years ago, we had chikungunya circulating in the Caribbean. We didn't get any transmission locally. Dengue's been around for a very long time, and now Zika. And certainly, we didn't see Zika as being a threat, and we didn't see West Nile as being a threat. So I don't know what the next threat is. We're all looking for it. But certainly, global warming and the introduction of not only new mosquitoes, because the mosquitoes that do transmit Zika and dengue and chikungunya are not native. One's African and one's Asian. But they're happy to live here as immigrants, and they do very well, and they can transmit a lot of these pathogens that could get introduced at any time. So it increases the potential.
Okay. Question for the snot guy.
Sure.
I thought I was called that with two small children, but I'm glad to know there's another one out there. In what ways does air pollution possibly contribute to, constant runny noses, sinus problems that we see, widely in the population?
It's a great question. So we just did a recent study exposing mice to Baltimore ambient air pollution, specifically 5 days a week for 4 months. And we find, if you take a look at the nose and sinuses of these mice, they have extreme inflammation similar to what we see in severe allergic rhinitis or chronic sinusitis. This is kind of interesting because years ago we thought, okay, well, if you're an allergic person and you're exposed to particulate or air pollution, you're going to get worse. But this study and one that Dr. Wills-Karp did years ago as well shows that the air pollution itself can instigate symptoms in a lot of people. And I think, the nose is a very ignored part of the body. There's a lot of a connection between the nose and the lung, but a lot of people write off the snot problems as, oh, that's a normal thing. And if you take a look at foreign countries like India and China, where the pollution levels are the highest, most people have some degree of sinonasal symptoms, and they chalk it off to be as normal. But it's probably a direct, implication of the air quality and what's going on. Excuse me. And certainly, if you are predisposed, if you are asthmatic, and you do have allergies, certainly air pollution can certainly make your condition worse. And we certainly see more people having more difficult times, specifically when there's more pollen, more air pollution, all of that. So it's a trigger, but it's also in itself can create symptoms for people that don't have pre-existing conditions also.
It's really interesting. And Dr. Wills-Karp, I'd like to expand on that and your own work a little bit about this idea of pollutants in the air triggering genetic reactions, right? And what sort of pollutants are we talking about?
Well, as my colleague here mentioned, probably in around 2000, we had done a study of the air outside of our building in downtown Baltimore. And we captured it from the window of the 6th floor of the building, and we exposed mice to it. And they developed all the symptoms of asthma without any allergens or any other stimulus. And their lungs were heavily inflamed. So one thing to point out is there is a genetic and an environmental component of asthma, but the rises in the incidence over the last 50 years have not been due to genetics. So this means there are new people developing disease from environmental determinants, not necessarily being genetically predisposed. And so one of the things that might be driving that is the air pollution. This is certainly true, and as he mentioned, in India and China, there are a lot of new cases of asthma, and pretty severe, because the levels of pollution there are 100 times greater than they are in the US at the moment. And I'd like to mention that in the 60s and 70s, they were quite high in the US. The Clean Air Act actually helped us clean that up. But if things are turned back as the current administration wants to do, we might be in the same position as countries around the world. We have seen a stabilization of the numbers of cases of asthma, which we attribute probably to these regulations. But if they are done away with or weakened, then we might be back where we were. I'd like to also mention that there are broader effects besides asthma and respiratory disease. We did a study recently in Boston in a birth cohort where we saw that very low levels of particulate inflammation influenced prematurity and intrauterine inflammation, which is always a bad prognosis for children. So there are lifetime changes that can be occurring. And the striking thing about this study, the levels in Boston are way below the national standard. So it says even the standard we have at the moment, if it's not reduced, is not sufficient to protect us from the effects of air pollution on a broad scale. And we haven't mentioned that cardiovascular disease or deaths are probably the biggest effect of air pollution. So there's asthma, but also cardiovascular deaths.
So the literature on this topic of climate change and health is really pretty striking that the brunt of the harm is most likely going forward and even today to fall disproportionately on vulnerable people, on vulnerable populations, whether it's pregnant women or children or the poor or the elderly, minorities, immigrants. Why is that? And how have you each seen that manifest itself, or not?
Well, I can speak to that. Many of the studies that were done to connect the effects of air pollution with asthma and other diseases show that the dominance of these effects are in urban areas, and generally in areas where children are living next to a big highway, where there's buses and other things, and these are usually in low-income areas, so heavily trafficked areas. The other is utilization of the healthcare system, because they don't get prevention, education, they don't go to see the physician when they start having asthma problems, and so there are more often more severe reactions and deaths because of the two, the exposures as well as the lack of access to healthcare.
I can certainly speak to this in terms of vector-borne diseases. I often get asked, I spend a lot of time in Africa working on malaria, a lot of time in South America working on things like dengue and Zika. And so why don't we see a lot of that here at home? And it's really attributable to the way most of us live. Most of us, Lyme disease is really the exception. Lyme disease is a disease where we expose ourselves by mostly our recreational activities. We go out and hike and picnic and become exposed to the ticks that transmit Lyme disease. But for mosquito-borne disease, it's usually a bit different, and it's really disproportionately affects disadvantaged populations that are high exposed, that have much higher exposure due to the quality of life. We live in air-conditioned and screened-in houses, keeps mosquitoes out. In places that can't afford that, those mosquitoes come in. They bite inside, they bite outside, and they transmit these pathogens to people that really have no other way of protecting themselves. So certainly that's largely attributable to that. In terms of global warming, what we see is really two things, both an expansion of those vector populations, those mosquito and tick populations as we've talked about, but also even at a much larger scale that's a bit scary for many of us that work in this field, is it creates a very unstable environment that can create dust storms that could cause asthma, but also unstable rains, which ironically, although we may see the same amount of rain over time, for example, last year and the past 2 years in Africa, we see about the same amount of rain, but it's become much more irregular and spaced out such that it effectively has increased the mosquito population the length of time. So we're still catching malaria mosquitoes in Africa, where usually our catches go to 0 in March or very early April, but still in May, we're still catching mosquitoes that can transmit disease. So these are the kinds of things that will be long-term effects on populations, both advantaged populations as well as disadvantaged populations.
So we live in a polarized political atmosphere, I think is an understatement. And as Marcia alluded to, it's very clear that the new administration views environmental regulations and action on climate change in a very different light than the last one did. And so let's forget a minute about the long-term, hundreds of years from now, the long-term health of the planet, right? How could whatever happens in Washington potentially affect public health now or in the near term, for better or worse?
Well, I think all the things that I pointed out that happen with air pollution and asthma will start happening immediately when they drop the standards, because industries will have no motivation to clean up their industry, will have no motivation to drive cleaner cars, and these effects will be rapid. They won't take years, and in fact, climate change isn't going to take hundreds of years either, as the current prediction models are. But the changes in effect to prematurity and these things are relatively rapid, and they happen within the span of, in fact, our study showed it's only in the first 3 months of pregnancy where the effects are. So the minute that these air pollution standards are rolled back, we're going to start seeing effects. What's interesting is because of the Clean Air and Clean Water Act, we were starting to see reversals in that, but now with climate change, those are going to be lost. Okay?
You mean in the public health?
The effects of the benefits that we saw with those, they're going to be lost, and that'll be fairly rapid effects.
The changes in Lyme disease have been very quick. I mean, Lyme disease really emerged in the late 1970s, so really only over several decades we've seen it go from the first 500 cases reported to hundreds of thousands, and that's been in my lifetime as a physician, so pretty quick.
Right.
Yeah, I agree as well. A lot of the exposure studies we do, like Marcia said, is a few months. So that's enough to create symptoms, create illness, and it's going to have a toll. So.
And yeah, it's very rapid. The one mosquito I talked about that is a primary man biter that can transmit all these viruses that we're afraid of, that was introduced into the U.S. in 1980, 80 to 85. And I remember being a graduate student in North Carolina too long ago, and it wasn't there yet. But now this mosquito is dispersed all the way up into New York State with stable populations. So that's just 40 years, and it's a huge expansion, and following a single introduction of this mosquito species. So those kinds of things, and not to mention another act we haven't talked too much about, but the Clean Water Act. Removal of that will increase pollutants in water, and so although this may not impact ticks so much, but mosquitoes with an aquatic larval stage are impacted largely by the environment. So although water quality may make some places inhospitable for some mosquitoes, like those that transmit Zika, those that transmit West Nile virus love polluted water, and polluted water can select for things like insecticide resistance as a sort of a co-selection quite rapidly. So polluted water could equal mosquitoes that are resistant to control measures quite readily and very fast.
I'd like to talk about a question that I struggle with a lot as a journalist covering the climate and covering the environment and as it relates to public health, which is it's often, and it relates to the last question too, it's often an issue that unfolds over time. Sometimes, a short amount of time, but sometimes years and decades. How can we as writers, as journalists, cover that in a fair way, in a compelling way, in a way that makes it tangible to people, the effects that changes in the environment are having on public health, whatever the piece of public health may be?
One of the things is that I notice is not just to focus on something when it becomes a crisis, but to try to be proactive like we are today about talking about the trends and not waiting till it's all of a sudden out of control. Right. So I think that's a big issue with Lyme disease and all these illnesses is that they're kind of insidious as they build, and if they're not associated with mortality, but with lots of morbidity, they may not get the public attention as much as something that has a high mortality rate. And so That would be one suggestion.
To build on that, that attention is not only at the public level, but also the congressional level, which sort of controls our funding and how well these things ultimately get studied and how much we know.
Right.
And certainly, we certainly see huge cycles in funding. I was, as I mentioned, present for the introduction of West Nile. We had huge introductions of funding emergency funding to respond to West Nile. And then just a few years after that, the funding went away and the interest went away. And so when there was a big outbreak in 2012 in Dallas that resulted in many, many cases and many deaths, the big question was, well, what happened? Why didn't we know about this? And really the funding went away for surveillance. For Zika, we're riding a small wave of funding to respond to Zika. And if the pattern holds true, as we've seen for everything else, that'll go away in just a little bit.
As the prevalence of the disease goes away.
As the prevalence and attention goes to other things, it'll go away. And then as the next one comes in, we'll wonder what happened to our surveillance programs, and they were eliminated because of limited budgets.
Right.
So I think asthma is something that seems to touch most people. If you ask anybody in a crowd, do you or anybody in your family or anyone around you have asthma, they will almost all say yes. So asthma in children, I think, is a punctuating thing to focus on in terms of air pollution, air quality, all the things that are wrapped up in climate change without having to invoke climate change. So it's something that we can keep reminding people that the increases in the disease are from exposures in the modern environment. Right. And what can we do about them? We can use more clean energy technologies, whether they're cars or low energy appliances, et cetera. Reduce meat consumption. Actually, cows generate a huge amount of the methane in the world. So just a simple reduction in our meat consumption can make a huge difference. So the other side of this is the economy, and I think that's where the pushback is on climate change. And we have to start thinking about the fact that there are states, I'm actually from Austin, Texas, and I was surprised to hear that Rick Perry was one of the kings of wind energy because it makes money. And so we need to influence the public that are suffering in the economy, that there are jobs. And there's been several reports that the most available and high-paying jobs right now are wind technicians with no training. They don't require any training. So there are ways to get out there and to change the economy and offer jobs to the public. And I think that's the part of the message don't generally deliver.
That somewhat goes into my next question here, which are the problems in some ways are clear and becoming clearer, and in some ways we know that we are going to see changes in our environment no matter what we do today. I mean, it's coming. And so I want to talk about what are some solutions, whether they be large ones or small ones. You know, what can people do on an individual basis? If I'm living in the middle of Baltimore or DC or any other American city, what could I do to be more resilient as these problems come? And then zooming out, what can society do to be more prepared? Where could the government actually be more helpful, whether it's through NIH research or screenings or whatever it may be when it comes to public health as these inevitable changes occur?
That's a great question. So I think from an individual aspect, it's a little tough because, you know, we spend a lot of time outdoors. Some people work outdoors for a living. So certainly if you're susceptible and you follow, like pollen levels and particulate levels, you can certainly try to avoid the peak hours of the day if you don't have to be outside, especially if it's an exacerbator. But again, this is very variable because some people have no choice in that aspect. But in terms of what can globally be done, obviously is awareness, grant funding, studying this to understand how air pollution actually causes these diseases and how we can intervene, either therapeutically or preventively with medications. That's the way that we can kind of prepare for the future.
I mean, with Lyme disease, personal protection is very important. So we encourage people to enjoy the out of doors, but we want them to take protective measures. And for instance, the adult ticks that feed in the fall and winter, we're seeing more and more with warmer climate exposure to tick bites. Even this year in February, we had tick bites because of the warm days over 70 degrees. So personal protection needs to become part of the culture of enjoying the out of doors. When you go out of doors, you have fun, but you wear long pants, you treat with certain compounds to get rid of the ticks, and then it should become part of the culture of enjoying the out of doors.
Even in Canada.
Even in Canada.
Especially.
Marcia, I just want to talk briefly about the center at Johns Hopkins that is going to be devoted to tackling environmental issues and the impact on public health. I know it's still early, and we won't hold you to anything, but what's the goal there, and what does success look like for that, as you define it?
So what he's referring to is the Environmental Health Science Department in Public Health just merged with an environmental engineering group. From the outside, you might say, why is that? But the way we see it is that public health practitioners are identifying the problems, the environmental problems that exist that we've talked about today, and the engineers are going to be able to design solutions for some of these. So how do we really make clean energy affordable, efficient, and be able to disseminate it to everyone? How do we design better water filtration systems? We haven't touched on that, but that's a huge problem as well. And when these huge rains occur, in Baltimore, hundreds, thousands of gallons of sewage go right into the bay when the rains are heavy. And all of that is in your water supply. The other thing we don't think about is we dump a lot of pharmaceutical drugs into the water supply. And we're beginning to understand that those levels are not diluted out like we thought they were. And in fact, with the interaction with sunlight and other things that you normally use through sanitation, they become more harmful sometimes. So we need to work with engineers who are able to design better systems for us so that we can still use the technologies that we have today. I don't see that we're ever going to go back to horses and buggies, but we have to be smarter in the design of our systems. So for instance, clean energy in electric cars. We need to make those more affordable. We need to make them so they go longer distances. Things that will encourage people to actually utilize those technologies. So what our goal is to be able to partner engineers with public health. So we're thinking about the public health implications and designing technologies that both work for you in terms of what your needs are in terms of transportation and other things, but are actually saving the environment. And so that's our ultimate goal, is to be able to offer technologies that not only generate jobs, but protect the environment at the same time.
That's interesting. I want to make sure and leave time for questions, so I'll just start winding down with on a happy note. What, as public, no, I'm kidding. As public health researchers, what most keeps you up at night when it comes to this topic? What worries you most about how this may evolve further when it comes to the climate changing and how that intersects with your particular specialty?
Okay, I'll start here. So one of the things I think, and hopefully this sort of feeds in from what Marcia just said, is sort of environmental protections being at risk, and the Environmental Protection Agency itself being at risk. We forget that this is, as one of our colleagues has more astutely said before, is we forget that this agency is really a public health agency that we sort of feed into, and it affects all of us in many different ways. So I think in terms of what we see for the future is a lot of work and a lot of challenges in terms of getting funding to provide the data that feeds into this system to create better interventions and control disease in a better way.
Mm-hmm. So as a practicing clinician, the best way to really manage disease is prevention. And I think, with widespread issues and more people being affected, prevention doesn't really become an option, and you're really trying to delve into therapeutics. And with decreased funding, that also becomes less tangible. So then you're left with people that have fewer and fewer options. So I think that's how we think as clinicians, as scientists as well. But really, if you can't help somebody, it's really something that keeps you up at night. Like, what can you do for this person?
Right.
So what keeps me up at night is the epidemic of Lyme disease increases. There is a subset of people that don't get better, and those who we study, the patients that have symptoms that are prolonged even after treatment, and that is becoming a big problem. If the incidence is, let's say, 5%, 5% of a big number is a big number. So what keeps me up at night is how to care for those patients better. We need better diagnostic tests and better therapies, and that's why we're looking at the impact of the immune system, because we really need better ways to help these patients.
So I guess what keeps me up at night, although my main focus is asthma, is that I see us in a rowboat about to go over a waterfall, and we have the paddles to be able to go backwards away from the waterfall, but we're going full steam ahead over the cliff. And it's inconceivable to me that with all the information we have at this point in time that we continue to row towards the cliff. And so I think our biggest challenge as public health investigators is to reach out to the public and have them understand how important this is. If we don't have water, air, and food, we don't exist. And climate change is threatening our very existence because of its impact on all of these crucial elements for survival. And we need to do something now. We don't have 100 years to start doing something. And, it's always, we hate to always be negative about these things, but there is good news. We can do things. Just the fact that there were thousands, I'd like to say hundreds of thousands of people out yesterday, is that we are getting that message across, but people need to know that they individually can contribute to making a difference. I named some things they could do individually, but then also putting the pressure on our government officials. And it's unbelievable. We're the only country in the world that doesn't believe, our politicians don't believe in climate change. So is the rest of the world wrong?
Would be happy, we still have time for questions if anybody wants to.
Thank you very much. I appreciate your perspective on this all-important topic. How do you guys feel about us employing bioengineering? So, for example, gene drives to eliminate for the white-footed mouse population for Lyme, or the Zika mosquito. These are technologies that actually either exist already or are right on the cusp of really being able to be deployed commercially, if we could use that term. So I'm just curious how you as panelists feel about things like bioengineering and geoengineering to address climate change, and how you might see them affecting public health.
So there was a human Lyme vaccine, which unfortunately was withdrawn from the market several years ago. So there's no current Lyme vaccine for humans, but there is a lot of promising research about vaccines for mice, because again, that's where the bacteria lives. And there's one project in the planning stage of CRISPR technology to alter the mouse susceptibility to Lyme disease, and they're piloting potentially a project up on Nantucket. It's in the preliminary stages. I think the key is having community buy-in, getting all the information out there so that people can vet it and really be comfortable with doing a project like that. But that's clearly the way to interrupt the cycle with Lyme disease, is to think about how to get at the mice.
And for mosquitoes, specifically the mosquitoes that transmit dengue, Zika, chikungunya, there is a system already in place that's, let's say, semi-commercial. And it works pretty well. It's suppressing the mosquito population. So it doesn't eliminate it, but it suppresses it beyond the point where it's big enough to be involved in transmission. And that particular system is very, very safe. in terms of the releasing a genetically modified mosquito in the environment. It can't propagate, so it really goes nowhere past the point of release. Better than an insecticide, some might say.
Playing devil's advocate here, we've heard, most of these bad effects are happening in the warmer weather and things, and I understand those completely. Are there any good things about climate change, i.e., with warmer weather, are we going to have less hypothermia medically? Are we going to have less influenza, which is a major killer? Is there an upside to it all?
So,
I don't
That's a tough
really.
so
one.
theoretically,
That's a tough question.
so theoretically, ticks that transmit Lyme disease, they are dependent on moisture, so they don't like to live in hot, arid regions. So a potential upside, if we turn Maryland into a desert, then the ticks wouldn't like it.
I guess the thing that struck me sitting here was a comparison of this whole area of climate change and worsening health conditions. Struck me the comparison with NIDA, the drug agency, in that the focus is on one area. It's on the negatives. And it's not taking a balanced view and looking at potential positives. So I'm just trying to get a more complete picture.
I'll say one brief thing about that, which is I think you're right. It's just figuring out where where it pans out, because if I'm remembering correctly, there will be fewer cold weather deaths, but heat kills far more people. So an increase in heat, offsets that even more. So, if you go across all the factors, where does that wind up, I think is probably the question. Not that there's no positive impact.
I was actually reading an article in preparation for this yesterday, and so one of the things it talked about in terms of climate change, not only destabilizing what we believe to be the norm, or what we've measured as the norm over time, so it makes it less predictable, which has a lot of downsides. Expansion of some species range, not only mosquitoes, but many different kinds of animals, potential expansion of ranges, reductions of ranges. For example, arid conditions are going to reduce mosquito populations in some areas because there simply won't be breeding habitats. Is that good? It may be good for some disease. It may be bad if you want to water crops. And so it becomes determining what that new balance is going to be. And so I agree, we tend to focus on the negative because as humans, we don't like change. We like things the same. But sometimes change could be good. It's just hard to know what the changes are going to result in and whether that's going to be something we like or we don't like. There could be some positives out of this in terms of new hybridization of species that might result in something new and beneficial. But certainly the reduction and loss of many species is also going to be a huge detriment to what we know and what we might be able to utilize.
So I want to turn to the mice in Baltimore, breathing that in for a bit. I guess it's two parts. First, is the mouse sinus, upper respiratory system sinuses really comparable to people's? And is it really were the concentrations really equivalent to Baltimore when you're talking about it, so that China and India are far worse, but this is something that's a real issue here in the US?
Those are great questions. So mice have very primitive sinuses. Obviously, if you want to take a look at animals that have similar sinuses to humans, you're really looking at monkeys and other larger animals. But certainly a lot of what we see in the mice, we can kind of carry that over to humans. So what we did here is we concentrated ambient air. So the concentrations that we saw were still probably half of what you see in China or India or less. So I think a lot of this is also situational, where you're positioned, like Dr. Wills-Karp was talking about. If you are in an elementary school playground that's located around the corner from a major freeway, certainly the particulate level in that specific area is going to be a lot different than someplace 3 or 4 miles down the road within the same city. So I think that's the take-home message, and it's not difficult to get a concentration 2 to 3 times higher in the same area. And obviously in India and China, you're looking at 5 times like higher, in a larger area. So it spans, it's hard to get away from. But I think it's cleaner here, but there are situationally areas that could be at high risk.
So to follow up on that, to show a little bit of cause and effect, there were some natural experiments that happened where out in the West they shut down certain coal plants. And they saw with the shutting down of those that their asthma admissions, hospitalizations, and things dropped dramatically. And those were the only known large-scale changes in those areas. So we have seen benefits from regulating greenhouse gases. It's just that we need to continue regulating them so that we don't have the levels that China and India do at the moment. But the study I told you about with prematurity, that's done in humans. That's a population study.
So there's
the
also a
levels-
study
yeah.
there's recently done at Hopkins that looked at kids in Sweden, I believe, because Sweden has a tax to drive on the road, basically. So it's actually decreased the number of vehicles on the road, and they see a decreased number of asthma exacerbations, and they've correlated cleaner air to decreased asthma. So there certainly are a lot of correlations that people have seen, specifically for the respiratory diseases.
Thank you.
I'd like to turn back to Zika, and in getting the message out, like the British firm that genetically altered the male mosquito, and then you could release it in the wild and it'd mate with the female, but the offspring wouldn't grow to maturity.
Right.
But the people in Key West voted against having this GMO mosquito released. So what do you do about something like that? I mean, it seems that while, you know, journalists don't enjoy a great reputation at the moment, scientists don't either.
Yeah.
So how do you get the public to understand what's real and what's really in their benefit, even though GMO is also kind of got a negative connotation?
Sure. It's an immense challenge. The best answer is education, education, education. The interesting thing about that situation in Key West, at the county level, it was actually voted for, and then at the local town level, it was voted against. So there's actually a mixed message there. You know, so at the larger scale, people are like, yay, but at the local level, they still vote no. But education, I think, has to be the key, mostly because I don't know another way. And making our message very digestible to a layperson audience. I understand at a very, very genetic level why there's no risk with those particular mosquitoes, but trying to convey that message to somebody that doesn't have a very deep understanding of genetics, we have to make that message much simpler. And it gets asked at all levels. I was actually asked by one of our MPH students just about a week ago exactly about those mosquitoes and what were the risk of the genetic modification of those male mosquitoes getting into the human population, which I was sort of surprised by because it was, well, one of our students, and I expected them to have a little better understanding of the basic concepts. And you know, so you have to go back and re-explain those at many levels and broaden that message. And I think that's where science writers as a group can really help us simplify that message or make it more digestible to a general public and get it out there and disseminate it much better than we as scientists tend to do.
Let's do maybe one last question here.
Thank you. Dr. Wills-Karp, you mentioned that cardiovascular deaths, you mentioned the connection between that and air pollution. Can you talk a little bit more about that? And then more broadly speaking of making things more digestible for your audience, for your reading audience, can any of you mention more examples like the Australia example where it's like this flash of understanding this A is connected to B and now we have 9 people dead and 10,000 people in the hospital, if that's the correct numbers?
Okay, the cardiovascular deaths, actually the largest associations with particulate matter exposure from combustion is with cardiovascular deaths. And there's it's a 12 or 24 hour delay from the time of peak particulate day to increase in heart attacks and visits for cardiorespiratory problems. We don't know the exact mechanisms. We know it's inflammation or immune related, but we don't understand the exact cause of why that is. These are generally people that have some type of cardiovascular risk already. And so what it tends to do is sort of hasten their deaths. So in calculating the numbers of years that were lost of individuals' lives, this is what they're showing, correlations with those spikes in the particulate matter. And so there's increased hospitalizations, increased deaths from cardiovascular disease. Again, the vulnerable population, folks that already have some cardiorespiratory problems to begin with. So that's probably the strongest correlation, even stronger relationship than with asthma, actually. And then the second part was digestible, about the thunderstorms. Is that what you're asking?
Basically, are there other examples that are as striking as the
striking. Well, that's why I
Australian?
used that one, because I think everyone can relate to that.
Think
Pollen
as well.
days.
Yeah, I mean, certainly, if you were to take a look at the incidence of people with symptomology, there's oftentimes a direct correlation just with, pollen counts. I mean, that's probably the most simplistic way. Especially in DC during this time of the year. I mean, it's been an awful 3 weeks of like the highest levels people have seen in years. So, I'm trying to think of anything else.
About a month ago, I was in a meeting in Florida, North Florida, near Jacksonville. And I know we all think of Florida as being pretty warm all year, but even North Florida gets a little cool during the winter. Cool enough that mosquitoes aren't quite so happy. But right now, they're seeing mosquitoes about a month ahead compared to prior years. And that was due to probably a very mild winter, due to global warming, due to global climate change. And so a month ahead may seem, oh, it's Florida, they have lots of mosquitoes anyway. A month ahead also means that's an entire Zika transmission cycle, or dengue transmission cycle, an entire cycle, not just from one human to the next. That's an entire generation of mosquitoes per year faster, which means the population's already past control thresholds now versus about a month from now.
Thank you.
I think we should probably leave it there, but I could keep going maybe another time. Thank you all for the expertise and a really important and fascinating discussion.